The Minister for Health, Dr. Ruth Aceng, has highlighted Uganda's ability to produce its own antiretroviral drugs, sufficient enough to meet the needs of the country's HIV patients. She also clarified the ongoing rumors about the closure of ARV clinics.
The flow of antiretrovirals is still as was and nothing has changed. And I want to reassure Ugandans that even if they withdrew their support for antiretroviral drugs, Uganda would still be able to support its 1.4 million people that are positive, but also the over 1.2 million that are already on antiretroviral drugs. So many of you know that HIV clinics were stand alone. So we are saying, can we now merge them with other existing clinics so that when you go to access your antiretroviral drugs, you'll have your blood pressure checked, you'll be checked for TB, you'll be checked for malaria, and many other things. We want to look at you as a holistic person, not as a disease. What had been created initially were verticalized programs that we are offering disease services.
She was inaugurating Uganda's 4th edition of the Pharma Healthcare Exhibition, where she encouraged local manufacturers to take advantage of the government's support.
Many of you are very much aware that the policy favors those who manufacture goods in-country. If you're importing, of course, you'll be met with increased verification fees and tax, as opposed to those who are manufacturing locally. Government also offers off-take agreements for locally manufactured goods. That gives you a reassured market for your goods.
She encouraged local pharmaceutical manufacturers to make the most of the available resources and market opportunities.
Therefore, I want to challenge you. Take up this mantle and ensure that we no longer have to buy Ebola kits. We don't have to buy IPC, infection prevention and control materials. We don't have to buy monoclonal antibodies. These items should be available in the country so that when we have any outbreak, we can hit the ground running.
The exhibition has attracted participants from various countries, including India, Egypt, showcasing a wide range of medical products and equipment.
And what as an organizer we have been trying is to bring more and more innovation technology for the market, which has a great demand. So
I've brought quite a number of items. Actually, all our equipment are currently on promotion from today until Saturday the 15th. And the reason we are running this promotion for these 3 days is so that Ugandans can have access to affordable health care.
Microhim. This is totally local manufacturing. Have 3 production lines. That is HIV, malaria, and sickle cell.
The exhibition will continue until Friday 15th with the theme Innovations in Healthcare, Shaping the Future of Pharma Healthcare in Uganda. Cayenne Faith, Stephen Kalicia for UBC.